Hi everyone, it's Dr. Danielle Cooper, Dallas plastic surgeon. I wanted to share some information that I just saw from a report from the International Society of Aesthetic Plastic Surgery that puts out a report that talks about the worldwide trends of aesthetic procedures. And so there was some information that I thought was pretty interesting, and I want to share those facts with you guys. So what they noted in 2021 was that there were over 12.8 million surgical procedures performed worldwide and over 17.5 million non-surgical aesthetic procedures performed worldwide. They did mention that the United States was number one in the number of surgical and non-surgical procedures performed, and is also number one in the number of surgeons that it has within its country, and the number of plastic surgeons that it has within its country. They did go on to give a little bit more detail and breakdown on the procedures that people were having throughout the world. And what they noted was that from 2020 to 2021, there was a 19.3% increase in aesthetic procedures, which is pretty interesting if you think about it, considering that that's when COVID was really ramping up. But despite this, plastic surgeons saw an increase in patients coming in for aesthetic procedures. And this is likely due to the fact that during COVID, we weren't able to travel. So people were actually saving money, not having to drive to work or not traveling. And so they used that money instead to use towards aesthetic procedures. Another thing that could be contributing to that, particularly when it comes to the increase in facial procedures that many surgeons saw, is what I like to call the Zoom effect, where a lot of patients were for work doing Zoom calls, probably looking at themselves more in the mirror and noticing aspects of their face that they wanted changed. So a lot of surgeons have actually seen an increase in the demand for facial aesthetic procedures. So a couple things that they pointed out was that there was about a 15% increase in facial and breast aesthetic procedures and about a 27% increase in body procedures. For your non-surgical procedures, there was a 23% increase in injectables and about a 21% increase in total face resurfacing procedures like lasers. They mentioned that the top 5 procedures worldwide were liposuction, breast augmentation, eyelid surgery, rhinoplasty, and tummy tuck. And if you break it down between the sexes, they saw that for women, breast augmentation actually took number 1, just followed by liposuction, followed by eyelid surgery, tummy tuck, and breast lift. Whereas for men, eyelid surgery was actually number 1, followed by gynecomastia surgery, which is surgery to address male breast tissue, and then liposuction, rhinoplasty, and then face fat injections actually made the list for the guys. For the non-surgical procedures worldwide, it didn't really differ between the sexes, but the most common procedure was Botox or other neuromodulators, followed by hyaluronic acid fillers. And then you had hair removal, skin tightening procedures, and then non-surgical fat reduction procedures that also made the list as far as the top 5. Going back to the United States, as I mentioned, they led the world in aesthetic procedures, actually making up 7.3 million procedures during 2021. And when you break down the procedures that have been popular in the United States, we see that for the face, eyelid surgery, facelift, and rhinoplasty were the top 3. For the breast, it was breast augmentation, breast lift, and breast reduction. And for the body, it was liposuction, tummy tuck, and actually buttock augmentation made the list for the top 3. Overall, the most common surgical procedures that were performed in the United States over that past year was liposuction, number 1, breast augmentation, tummy tuck, breast lift, and eyelid surgery. And then when you look at the non-surgical procedures, again, Botox, fillers, and skin tightening modalities made the list for the top 3. So that was just some interesting information that I saw in the report, and I wanted to share that with you guys. So if you have any questions, feel free to reach out. Happy to answer any questions that you might have.